Hi Donna, I'm here to do my NG tube insertion. First I walk in the room and I would let the patient know what I am going to be doing, and then I would have to assess my patient. I would have to see if he's had any nasal surgeries in the past, any polyps, any problems septum deviation, and make sure that his nose is clear in the nostril I choose to use. So I would check, and I think this nostril would be fine. So I would make sure I have a chuck for him. And then I would also make sure I have a paper towel for anything that comes out of the mouth. And then if he gets anything, here's an emesis basis. So then after I do that, I would need to measure with the tube how far the tube is going to be going down. So I measure from the tip of the nose and make sure the patient is sitting kind of at an angle upright and to be more comfortable. And then I would go to the earlobe. Then I would go to the end of by the xiphoid process at the end of it. So then I would take a piece of tape and mark where the tube should be inserted that far down to the stomach. So after I do that, then I need to curl my tube. And I curl my tube so it's easier to go through the nasal cavity. And then I insert it about 3 to 4 inches. And while I'm doing that, of course, another person might be helping me. And I would have them, he'd start to gag a little bit, a gag reflex. I would have him swallow, 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 until the tube reaches down the stomach. I would never let go of that tube. Once the tube is in place, then I would take a piece of tape, attach it to the bridge of the nose, and I would wrap the tape is it's cut in half on the half part of it. I would wrap it around the tube to make sure that it stays there. Then I would leave the rest of it until I know for placement for sure that the tube is in place. So then I would take a 60cc syringe, and I would then put 5 to 10 things of air in there, and I would check for placement of the tube. So that I would have to have my stethoscope, and I would want to make sure that placement was in place. So I would check, and I should hear a whoosh sound while I do this. Yep, I did. Then I would like to aspirate back to get a little bit of the stomach contents. Then I would connect this back up. Okay, then I would want to check my pH. And I would have a strip here, and then I would check it. And if it's 0 to 4, it'll be fine. It's in the stomach area, stomach contents, so it is good. Then I would have to secure it to the nose the rest of the way, so the tube does not move. Okay. Once it's secured in place, excuse me. I need to check at the back of the throat to make sure that there's nothing curled up in the throat. Make sure that it's all good and it's down into the stomach to make sure if there was more gagging reflex. Since it is okay, then I would hook it up to the suction. Okay, after it's hooked up to suction, I would turn it on to low intermittent suction, and then I would have to check for, actually I wouldn't have to check for placement, but I would have to check for the, I would actually have to pump 5 to 10 cc's of air into the blue tube to make sure it gets away from the wall of the stomach. So I would take this off, and then I would put in 5 to 10 cc's of air into there so it's away from the stomach wall. Okay? Then I would attach, oops, sorry. Then I would attach the tube to the patient's gown by another piece of tape, and I could tape it on the tube and then take a safety pin and then put it on there, so on the gown, so it, and give him a little bit of flexibility with the tube, so it he can move his head back and forth with no problems. And that ends the insertion of the NG tube.